Welcome to this week's episode of Surgeon Interrupted. Today, we are going to Paris, at least in spirit. I'm joined by Dr. Abi Jaoude, a neurosurgeon who works at one of the largest centers in Paris. And I met her a few months ago across the street from the Palais Garnier. And we had just the loveliest several-hour kind of aperitivo at the cafe. What we really bonded over was the culture of surgery, in our respective practices and countries. And so there's a lot about the life and culture of being a French surgeon, formerly originally from Lebanon, but now a practicing French neurosurgeon that I cannot wait to share with all of you guys. So Samiya joins me here today. She's just an incredible insight into a different world and a different way for us to relate to our work and I think one another in the hospital.
Thank you so much, Frances May, for having me. It was really a pleasure meeting you in Paris, having a very long aperitivo. One of those conversations that start with, simple discussion, and then it morphs into something larger, and then we have to take it further. So I'm very glad to
Exactly.
be on the podcast with you.
Yeah, some fun backstory is that I had my first oyster at that aperitivo, and you really walked me through that. That made me feel like I wish I was your resident though, because you walked me through it calmly. I did not understand the little spoon. I'd never really touched an oyster before, so
I felt a little bit like forcing you, but then it was a very nice experience to have together, and I have it documented. So yeah, Frances May
yes.
did have an oyster.
Oh my gosh. Yeah, we were like, Mom is not going to believe this. So thank you for getting the video. That was very important. Okay, well, I cannot wait. I'm excited to hop into it. So to share with you guys, we literally were just talking, and of course I wanted to do a formal intro and everything. And I was like, I'd love to just call you Samiya and please, call
Yes,
me
please.
Frances May for the recording. And you shared actually in French surgery culture, people primarily tend to go by their first names. Is that right?
Yeah, not just surgery culture, all of the hospital culture. You know, when I did my residency in Lebanon, where everything is very formal, we call people Doctor Samiya, Doctor
Mm-hmm.
Abi Jaoude, whatever. And I
Mm-hmm.
arrive here, and everybody calls everybody, nurses, residents, interns, doctors call each other by their first names. And it took me a while to be able to absorb that. Of course, most of the departments still call their boss or the chief of department doctor something or professor something, but in day-to-day life, my nurses, my interns, my residents, and my colleague just call me Samiya in the OR and on the floor. It's the norm. I guess French people took killing their king all the way, and there are no more formalities left in the hospital. So unless it's it's the boss of surgery or the boss of the head of anesthesia, and we just use our first names.
I really like that. I feel like I would have gotten on board with it because in the strict hierarchy here, even when I graduated, when I had attendings say to me, now you could just call me by my first name, it felt very foreign and a little scary, the same way that when you're a kid and you meet your friend's parents, you don't
Yeah,
call them by their first name,
yeah, of
out of
course.
respect and the hierarchy, the power dynamic and fear. That's really what it felt like.
Yeah, and we've already had the discussion about hierarchy here. It's very different from what you guys have. It's very strict and it starts very young. And no, here people just, it's a culture where people try to remove those barriers and just have a simple conversation and call me by my name. Very few
Yeah.
of my nurses, maybe those who are just arriving in the OR, call us doctor, whatever. But then a few weeks later, we're quickly gonna say, "Stop calling me that." In French, we also say "vous" instead of "tu." So it's a polite way of speaking to people, but very quickly you switch to just speaking avec un "tu," which is the singular form of you.
Mm-hmm. Amazing. Yeah, there's a couple of these things I wanted to hit on. And so, okay, you just talked a little bit about the hierarchy. What I found really fascinating is, can you speak to, like, in residency training, so for a person, we'll say the neurosurgery residents in Paris, it was fascinating to me that you described that there wasn't this concept of like the really strict junior call, the senior call, junior versus senior call, stuff like that. There's just one call pool
Yep.
that the residents are in. This is
Yes.
still blowing my mind all over again. Yeah, I mean, how does that work structurally? And you're saying that a fourth year resident could be taking the same call that on
Yes.
Wednesday that a first year resident took on Tuesday.
Yes. There is no concept of residence hierarchy in France. Um, you may be the unlucky senior who has the first year today, and you might be the lucky one with the fourth year tomorrow, but there is no difference, and there is no hierarchy between residents. The fourth year is not responsible of the second year, and he has no say on his times in the OR, on his vacation, on his calls. It's just a pool. What we usually do is just assign the role of a pseudo chief resident to the eldest of the group, just so that he can organize who goes to what OR what day and who's on the floor what day. But it's just an organization thing, and not really, he doesn't order them around. He cannot choose. If they don't want to go, it's a discussion they can organize between themselves. The only direct hierarchy to the resident is the chief of.
Well, and like, so there's an attending who takes call with the residents, like you said,
Yes.
and like that attending might have a lucky night with a very experienced resident on call, or an
Yeah.
unlucky night.
Either way, it's the responsibility of the senior surgeon. So residents here, they can do small things to get alone. In neurosurgery, is putting an EVD or draining a subdural hematoma, but it's still the responsibility of the surgeon, of the senior surgeon. Theoretically, we're supposed to come to the hospital if it's an on-call, if it's not an in-house call. We're supposed to come. No matter how old the resident is. But
Mm.
in most of the hospitals, if it's an older residents, we can allow ourselves some leniency. But it's still my responsibility whether he's a first year or a fourth year.
I really am just very intrigued by this whole concept because in my experience and that of like many people have shared with me, their residency experience, especially in surgery, I do think it's wild. The residents kind of like, are responsible for each other. We see a lot of direct, even just bullying and poor treatment from
Yeah.
people slightly above, like a 3 will bully a 2 at times. I mean,
Yeah,
and it
you told
just
me about that, and I found that extremely fascinating because, well, this doesn't exist. There's how do we say it? Teasing, but cannot go so far as bullying because he's not directly responsible.
exactly, because you're just really more like coworkers,
Yes.
right? And it isn't like, hey, I've um deputized you to go and be in charge of these little people like your team. That's usually how it is here. And I just really like, to me, it makes much more sense to have attending surgeons, or what you're describing, a senior surgeon. That person is in charge. They also presumably have at least some interest in teaching, and hopefully, I hope to God, right, that they have skill in teaching. Whereas in residency, oftentimes your senior residents don't have any formal education in how to teach, maybe even no interest in teaching whatsoever, and then the more junior residents suffer for that, and their education suffers.
Yeah, it's very fascinating to me that the US culture expects a second year resident to teach a first year resident. He maybe saw 6 more months. Sometimes the difference between the two is a few months. So it's very fascinating. Why would anyone expect a second or third year resident to teach? We all did this, teaching the first year how to put an EVD. But it's more like you're my coworker and we're supposed to help each other out. It's not me bossing you around and teasing you that you cannot do it. But it has its disadvantages as well, because since there is no hierarchy, at no point French residents learn about the concept of pyramidal hierarchy and how to respect it, or how to become themselves leaders or to manage a group. One day they will become a chief of a department or something, and they had no experience whatsoever in managing or training or anything. And it doesn't mean that if we're senior surgeons, it's necessarily that we have more um, teaching affinities or but at least, well, we finished our residency and we had
Yeah.
more experience.
Okay, interesting. So can you speak to that? Like for senior attendings, is it more that they love surgery, they love their job, and part of the job is going to be like teaching and overseeing residents?
Yeah, and it's very ingrained in the French culture, the concept of compagnonnage, of teaching the younger ones. It's part of our oath to really be training younger ones. There are some surgeons, older surgeons who really don't want to teach anything, but most of us work in university hospitals or teaching hospitals, and it's part of our, job description to teach and to train younger residents. How am I to expect that the first year resident who doesn't know how to do anything, and it's normal, it's not his fault, he just started. How am I gonna
Uh-huh.
expect him to know anything if I'm not teaching him? So yeah, the concept of train, uh, um, take them by the hand is very ingrained. But you still see some surgeons, sometimes my age, not so often. They are more often older who are not very interested in teaching. Um, but even those surgeons who leave university or teaching hospitals and go to private practices are still, a lot of them are still involved in teaching opportunities and, giving back or trying to, sometimes it's just for, personal gain
Mm-hmm.
because they need help in their ORs, but no one would come
Right.
with them if they don't teach people, So,
Yes, exactly. Kind of the symbiotic relationship. Absolutely. But I do think that even this agency that you're describing, which is like, you know, my first year residents, they weren't born knowing how to do this
mm,
procedure. And if I don't teach them, like again, it's not the expectation that they came in knowing. I think that what I've seen weaponized that again is just detrimental in our system is where, um, let's say a resident's really struggling. Then I've seen attending say, to their senior residents, to the senior residents of the struggling person, hey, you're not teaching them enough. Why didn't you teach them this? Right. And then I've seen fives say to the twos, hey, our ones are not up to snuff. And that is 100% your fault.
in a
In
system where
departmental meetings, like that type of rhetoric.
uh, in a system where this is what's expected, where hierarchy is expected to be really teaching, you can hold people accountable. If the first hasn't learned to put an EVD, extraventricular drain, that's an
Uh
EVD,
huh.
I'm sorry about that,
Uh huh.
after 6 months of residency, and if it's the second year's job to teach him, then yes, you hold him accountable. And I can understand that from a perspective where this is how the system is supposed to be. But for it to be weaponized is kind of cruel. And at the end of the day, I even though it's the system that way, it's always the responsibility of the attending to make sure that everybody's teaching, everybody's being taught in a, homogeneous manner and is being, having, being up to where we expect them to be at this point of their curriculum. It's not the resident that has really no responsibility.
Totally, totally. And I do want to say, of course, as the disclaimer, I often speak to my own experiences. I have seen a lot of trends where in the US, like medicine versus surgery, there's a big divide there. Those residency experiences can be very different. And then even for surgery, some surgical residents have a great experience. But what I find most problematic is exactly what you're speaking to, which is a lack of homogeneity here. Like, I really believe in we need to bring the floor up so that bad surgical residency experiences are nowhere near as horrible as they can be, which like there's a lot of people who fall through the cracks or don't receive, even
Enough.
education compared to some peers. So, okay, to shift to something much more fun, I loved the language of a totally new phenomenon, a thing you described to me, which is called the right to disconnect.
Yeah. I'm fascinated that you don't have that. I'm like, what?
I've never never heard of it in my life. I love it. I think it's so beautiful, like even from a vernacular and kind of syntax standpoint. So the right to disconnect, I think that there's a lot built into, of course, the French work schedule that plays
Yes.
out interestingly for surgeons. My understanding, is it correct that it's a 35-hour limit on work week, and then is it
Mm,
mandatory minimum
yes and
3
no.
weeks? Okay.
So there are two things going on there. There's the
Uh-huh.
right to disconnect, which is a little bit French, but it's more because of the, it's our age, it's our us being connected all the time, and it comes more from the
Uh-huh.
business world, and hospitals started to adopt it recently. And then there is the limited hour week in the French law system. But does it actually
Uh-huh.
apply? I don't want to romanticize the French medical experience or surgical experience, but French people have we have a law that says all French workers cannot work more than 35 hours per week. People might think that we don't work enough, and all of the country has 5 weeks of vacation per year. I'm sorry. But that does not apply strictly to doctors, because sometimes when I'm on call, I do my 35 hours in 2 days, but that doesn't mean I
Uh-huh.
don't work for the rest of the week. I then don't get extra days off. But you know, it's the 35-hour cutoff does not really apply to doctors, but it is not expected of doctors to pick up the phone after they've left the hospital. It's not expected to reply to your emails at the middle of the night, and the weekends and the vacation days are sacred. So it's that accompanies the fact that people have the right to be at home with their families and friends and just have their time off. But it doesn't mean we only work 35 hours a week. We wish that would
Exactly.
apply for us.
Well, right. Yeah, that's the dream. But correct me if I'm wrong because of course, part of being a surgeon is still working 60, 80 hours a week. And as you mentioned, like call weeks will be that way. But do you have extra vacation time
Yes,
to kind of make up that difference, right?
yes,
I think you
yes,
alluded to like a couple
yes,
extra weeks
yes,
that are
exactly.
kind of tacked
3
on
weeks.
to 3 extra weeks. Okay, so
Yes,
you're at 8 weeks a year, right?
yes, I have 8 weeks a year. So the rest of the population who work 35 hours per week get 5 weeks a year. This is their paid time off, and this is what's in the French law. It's written, how it is. Black and white, unmovable. But then there are others like us, nurses, some other, those who work in politics or those who work
Mhm.
in HR. Sometimes you work way beyond the 35 hours. And the system makes it that you get extra days off. We call them RTT.
Mhm.
It's, more days to compensate the fact that we do not work on the 35 hours. So I get 14 extra days, which is 3 weeks. So total, I have 8 weeks off per year, and I think a lot of American surgeons are currently, 8 weeks. And I've had this discussion as well with Japanese doctors who thought that it's completely crazy to have 8 weeks. That would mean that I'm not essential to my job if I have that many days off. But yeah,
Well, I love it so much, and I definitely want to reiterate for everyone, like, we've known each other and been talking for some time now. So I will say, right, like you are a classic neurosurgeon to
yes,
me. And I mean that in a complimentary fashion. Like I'm just saying you work really hard, care
yes,
an extraordinary amount about your work. I would not say like, "Oh, you're just a different kind of you're a chill neurosurgeon. You're just like,
not at all.
so yeah, you don't care, you're on vacation all the time." I think that so that's what's really magical to me though is that like if you were in the US, I could see you working a job that is 4 or 5 weeks of PTO. I had 5 weeks of PTO at my job. I could see you having that job, but it's frowned upon in some places to actually take it, especially for a surgeon to like find call coverage and things like that. So I think if you were just plopped into this system, it would be really hard to take that time. But I love seeing you use up your full 8 weeks because
Yes,
it's so the norm there. Like, I think it makes
yes,
it then easy for even really high achievers, hard workers
yeah,
to do it, right? Like, do you feel like
exactly.
people would almost glance at you sideways if you didn't take your time?
it's not glance sideways. I would literally get a call from the direction of the hospital, like, you still have days, you need to take them before the end of the month. We literally have that call every year, and our vacation days are weirdly in a year. They start from the beginning of June, and we need to take them by the end of May next year. They're not aligned
Mm,
by with the calendar year. So usually by March we start getting calls from HR saying, like, Samiya still has 13 days, and Alistair still has 10 days, and the chief of department has 20 days, and there isn't enough weeks left for you to take your days. So start doing something as of now. And so, yeah, I'm not a chill neurosurgeon. On the contrary, I'm one of those, you know, just like you say, type A surgeon who wants to
yeah.
do it all, but I have to take my vacations just for my mental health. But then it's in my department. If I don't take them, they get lost. And in the French system, it's considered that this is part of your pay. Your vacation days are part of your pay. So why don't you take them?
Wow. Yeah, I just think that a lot of I think a lot of us would be doing better on the US side if that was the norm. Because again, I think that context and environment plays a big role.
Yes.
Like, there are doctors here who haven't taken a vacation in 5 years, where maybe if they went into an environment where that was more the norm, that they suddenly, right, or where, your chief is calling you, "Hey, what's up? You have some vacation time left. Like, can you get on that?" I just even think that encouragement.
Some of us, don't. Sometimes it's a lot of vacation days. We have to admit that. So sometimes we don't finish them over a year, and it's in a negotiation with the hospital management. So they push it for another year.
Mhm.
And in the public system, there is a different way. If you don't take the vacations off, you can accumulate them in like an account. You can accumulate the days you don't take every year. You take your vacation days, and if you have
Mhm.
days left, you put them in an account, and then you use them up when you are close to retirement, so you can retire a few months earlier.
Wow.
Yes. So that's
I
what
love that
happened in the
too.
public system. In completely private systems, if you don't
Mhm.
take your full vacation days off, the hospital has to pay you the days that you didn't take off. So why does my department, my hospital, insist that I take them? Because the French law would force them to pay me if I don't take the days off. So I take them, and
Wow.
they would say, if you don't take them, we're not gonna pay you, and you would have lost days. So yes, we take them because, well, it's a loss of days and or money, if you want to see it that way. If I don't take them, but
Mm.
I understand that in some departments, some systems, it's difficult to take those days. When I was a resident, one of the hospitals where I was had this discussion where, like, do you take all of your vacation days off? And this, yes, we do. We had, we took our vacation days, but then on post call, it would be frowned upon if we left early. As well, you're taking all of your vacation days. Why are
Mhm.
you leaving post call? So yeah, it's a balance. And I think the French found a way around the system to take all of your days.
Yeah, and no system is perfect. So I appreciate your note about, I think it's easy as an American, just speaking for myself personally, definitely easy to romanticize French
Yeah.
life and, French medical culture. So, I'm not arguing that any country has it just 100% right. Although there are, again, interesting lessons, like when I've connected with my New Zealand and Australian physician friends. I mean, like, I think that there are several countries that get many things right for the physician. Um,
Well, I think
but
it's a work in progress in a lot of cultures, because it has become so clear that we pushed our doctors too far, asking too much of them. And, well, for example, this is something negative about the French system. We're not paid enough. The numbers are much far way too different from the rest of the world, but
Mhm.
we get vacation days off. So, well, I guess it's since different systems, us, you, New Zealand, Britain, Germany, are trying to compensate or putting more measures to make this what we do more attractive. Because, well, I don't know about the US, but fewer and fewer people are going into med school here in Europe.
Yeah, I think that the trouble is not just make it attractive, but make it sustainable. Because what I
Yes.
think is interesting about people like us, type A, high achieving, many of us will go, 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 go until something or someone stops you. And so the more that like protections and healthy, sustainable lifestyles are like built into the system or the career, the better. I mean, obviously, I'm not saying the whole onus is on the system. We can also do better to like model for young physicians the importance of this stuff because in contrast to what you're describing, kind of the lower pay there, I mean, here in the US, sometimes it's like, okay, proceduralists can be paid really well and you get paid proportional to how much you work. And some people work no time off, work themselves to the bone for several years, and then they're like, "Why am I an empty shell of a person?"
Yeah, I understand. Here, there are three types of doctors and surgeons. I'll speak specifically to surgeons: the public system, the private system, and there is one system that is in between. But the public and the system in between, in which I am, we have salaries. Whether I would do 12 cases or 27 cases, it's the same salary. So,
Mhm.
um, working myself to death would be seeing more patients, cramping more surgeries during the day, but will not get me a higher pay. And well, at the end of the day, I would be completely exhausted, spend my life in the hospital. And it's a balance. And it's also the importance of having a team that, speaks together, that, can cover for each other, who work really together. Because, yeah, how that saying says, one hand alone doesn't clap. So really need a team to work together.
Well, yeah, that's a lovely quote. Well, and yes, I'd love to spend a little bit of time specifically on the right to disconnect, which, yes, like you said, this
Yes.
is separate from like French law governing vacation time. But oh, that's so cool. I didn't know it originated from like the business sectors and things like that. Again,
Yes.
I have not seen it here. It may have already been imbued in some US cultures. I had not heard of it. And I really extra had not heard of it for physicians. So can you speak on what it practically can look like for a physician to have maybe like a right to disconnect away message auto reply on their email?
Yes. The first time I saw it, we started hearing about this a few years ago when, there was this trend about digital detox or, taking time away from your phone and
Mhm.
your laptop and things like that. And the first time I saw it written, it was at the end of my fellowship. Of course, because during my fellowship, all of this was not true. I worked day and night because I was building, my skills. But at the end of my fellowship, at the beginning of my attending years, I sent an email to a neurologist around 7:30 p.m., and I received an automatic reply that I have received your message. Do not expect an answer tonight because I use my right to disconnect, so I do not reply to emails in the evening or in the weekend. I was like, my God, this is so interesting, and it pushed me to do some form of the same. So I removed my professional email from my personal phone. I don't have my professional
Mhm.
email on my personal phone, and the work WhatsApp groups, and things like that are muted. And I have zero obligation to pick up the phone after I've left the hospital if I'm not on call, of course, because we have a rotating
Mhm.
call. And if I'm on call, I sure have to pick up the phone. The rest of the time, I don't need to. And it's like a hospital policy. They recently sent us a reminder of how to use emails proficiently, because there's also the question of ecology, of not using too much of server time or things like that. And at the end of
Hmm.
the email rules, there's one down there that says the doctors have a right to disconnect. The doctors and everyone in the hospital has a right to disconnect. So do not send an email after hours. Do not, and if you do, because you can do whatever you want, but if you do not expect an answer in the middle of the night or on weekends and during someone's vacation. So if you receive a message that says, I'm currently away from the office and I will be back on, I don't know,
Mhm.
December 12th, do not insist. They will see your message when they come back. And it's your right completely to still check your mail when you're away. I don't do
Yeah.
it, but for one of my colleagues says that if he doesn't do it, when he comes back, it's overwhelming. So he takes
Mm.
an hour every 2, 3 days to, filter through things. And I understand, but no one is expecting me to reply. So my secretary during my vacation will tell patients if it's not an emergency that I'm away, and if it's an emergency, I always give her one of my colleagues' names so she can ask him while I'm away. And this is how it works. Um, you're not expected to pick up the phone on the weekend. There is a surgeon on call who will answer for everybody in the hospital, for all the patients.
Hmm. Yes, of course. It makes a lot of sense. And honestly, I do think that there are probably institutions and employers here in the US who would maybe say that. Like maybe they would say, okay, you're not required or expected to reply to emails on the weekends. But I think that there would be an unspoken layer that's like, if you don't though, I might judge you accordingly or
Yes.
something like that. And I just haven't seen people take the extra step, basically a further step like what you're describing. But I mean, I feel like it would bring me a lot of joy to get an email auto reply that says, I'm exercising my right to disconnect. I feel like I need to update mine.
Well, I think it's the future of interactions. Up until, a few 20 years ago, we didn't have emails and a phone with us all the time. And now that we've had them so much time, we're realizing we've become, it has become an extension of our arms and eyes. So let's take some time to just reconnect to our actual life, to our friends, our families, museums, and our books, or whatever you would like to do on your time off.
That's amazing. I mean, it's been really wonderful, I think, to dig into this with you. Um, like I said, just more kind of sharing some
Yes,
ideas from other systems today so that we can ideate. Like, again, we don't have all the solutions, and
of course not.
but I do like one of my favorite quotes of all time is Peter Drucker's culture eats strategy for breakfast.
Yes,
And that is so true. Because again, like a hospital could implement a new policy which says, okay, you have a right to disconnect. But then if all of your coworkers get mad at you if you disconnect, culture eats strategy for breakfast. So I mean, like I do think that
yes,
the
I agree.
culture piece of it
I'm,
is
I'm
really
sure because when I was a resident, that wasn't a long time ago. That was five, no, during my fellowship. I'll go for my fellowship. That was
Mhm.
5 years ago. I was expected to pick up the phone anytime. But that was
Yep.
because I was a fellow. But I didn't expect my senior attendings to pick up on the phone on Saturdays. I never called the chief of department or any of the older attendings
Mhm.
on a Saturday. But fellows are expected to pick the phone anytime. It's somehow expected of them to be available, think, thinking of it as their training. But fellows do not call attendings, and it has been ingrained since forever. We don't bother them. Uh,
What
in the
about
night.
residents? Is that also pretty much on all the time?
If I'm on call
Available?
and there's a resident, no, he has to call me. It's unexpected, unacceptable that he doesn't. If it's for, important things.
Right,
For a
but
prescription of paracetamol, I don't need him to call me, but he cannot admit a brain bleed without calling me. It's
for sure. No,
unacceptable.
of course. But I just mean like if let's say that the resident, it's the evening and they're not on call, do they have the right to disconnect? Because you kind of described that the fellow doesn't really.
Yeah, but actually, if there is one resident who's on call, why would I need to call the others? See what I mean? Um,
For sure.
no,
No, it makes perfect sense. And I feel like this goes back to your residents being coworkers or not. Because I will say I got phone calls all the time as a resident when I was not on call. And it could be a variety of things. An attending could have a question about a different patient that maybe we saw together a few days ago. They want to talk about it. It could be that a co-resident is having some kind of an issue. Like sometimes,
okay.
okay,
During the
hey,
day, that happens all the time. But at 10 in the
it
evening,
would
no,
be at night. Yeah, it would
no.
be at night because we were all working during the day. So it wouldn't be like 10 p.m. I was asleep at 10 p.m., but I'm talking like, I mean, I'm at home, 7, 8 o'clock. It's a weekend morning. I'm not on call, but like a co-resident, who either it's a junior asking for advice or it's a senior with a problem down from above. Like we just had all these extra phone calls because that would all not be clinical work.
Down from above, not so much. Possibly and easily because, well, it's the culture where it's expected to be, they're coworkers, we're coworkers, we help each other. I wouldn't be I used to have calls when I was, a fifth year and a sixth year. I used to have calls all the time from the first year, second year, even though
Mm,
I wasn't responsible at them. But, I was much older. I was almost a fellow, but they would call with questions, but they would not call at 7 in the morning. If it's an
mhm.
extreme emergency, maybe, but the rest of the time they call the attending who's on call with them. But if it's something minor, they don't want to bother them or they
Yeah,
don't want to seem
for sure.
stupid. They
Yeah,
they they ask, and it's easily accepted in the sense of, companionship and working together. Not as,
understood.
call you at 7 in the morning. Why is she doing this? That doesn't happen. Not really.
Amazing. Okay, well, do you have any wisdom that you would like to leave us with today? I know that educating and kind of being a really strong role model for the next generation of physicians and surgeons is an area of passion of yours. And I mean, I think that that shines through. Would
Thank you.
love to have you back to do a deep dive on that whole side of things another day. But just
Avec plaisir.
any wisdom that you'd like to leave us with today?
Well, I think what the American system can take from the French system is this, disconnecting, trying to find a more balanced work life, uh, you know, motum, because, well, we can work ourselves to exhaustion, to burnout, and at the end of the day, life passes and we don't see it. We weren't there. And a lot of my friends tell me in the US, it's expected of them to be at the hospital at 5 in the morning and sometimes not leave until 10 in the evening. There's something wrong with that. And I think it's a really important work that you're doing, trying to find a way to balance work and life and, advocate for that. So that's it.
Amazing. Amazing. I love it. Thank you so much for pulling back the curtain on, our respective systems. I think that to me, if I had to lower it down to one word, I would just say that there's something about the French system that feels more intentional. And I love it. It feeds into this work-life balance concept. Thank you so much for being here today.
Thank you. It was really a pleasure to have this discussion with you.
Thank you so much for tuning in to this week's episode of Surgeon Interrupted. If you enjoyed the episode, please subscribe, rate, and leave us a review. Check out our sponsor, Hippocratic Collective, for more shows and content like this at hippocratic-collective.com. Samiya, thank you again. And to everyone listening, remember that your life outside the hospital matters just as much as the life inside of it.